Okay, so we'll be starting now. Hello everyone. I am Mohammed Al Mahal. I am Sudanese American Medical Association intern, and I'll be facilitating this session for you. Thank you for Nurse Khadija and Nurse Mustafa for coming today. We are very glad to host them in our session, and also welcome Dr. Salah, treasurer of SAMA. So the session is going to be a 1-hour session. I'll be having about 5 minutes giving pre-presentation and housekeeping rules, and then we'll be having the session traffic zones inside the operating room in 40 minutes with Nurse Mustafa and Nurse Khadija, and then we'll be having 15 minutes for question and answers. So this session mainly is to provide nurses in Sudan with the knowledge necessary to pursue their career in operative nursing. And we have chosen this topic today, the traffic zones in the operating room, as the first session too. Please, for all of our participants, rename your name in Zoom, enter your name and then your designation and location. And this part of the Zoom features, you can use the mic icon for muting and unmuting yourself. Please don't unmute yourself. Then you can use the share of the screen if required, the middle button, and then the chat box for posting your questions or comments. Please, for all of our participants, introduce yourself in the chat box. As I've said, enter your name, your designation, and mute when not speaking, and if appropriate, position the webcam appropriately so that the whole face is visible. Please make your phone silent and raise your hand if you have a question, or just simply post your question in the chat box. Welcome to our again to our SMEs, Mustafa and Khadija. Please, Mustafa and Khadija, introduce yourself, and then you can share your screen.
Hello everyone, my name is Khadija. I'm clinical nurse in operating room. I'm happy to have you all, and I'm very grateful and thankful to Dr. Salah, Mr. Muhammad, and Mr. Mustafa for giving us this opportunity and chances. This lecture will be about operating room. It's kind of a start, as the operating room is a wide area to discuss, and there is a lot of information to learn. So please, after finishing this session, if you have any question, if you have any area you think it could help you in your future or in your plan or even in your knowledge, let us know so we can proceed for further education and for further actions in the future. Thank you very much. This is from my side, and I will leave it for Mustafa now.
Thank you so much, Sister Khadija. My name is Mustafa Zohni. I am nurse educator in Hamad General Hospital, Operation Theater. I am so happy to be with you today. It is my pleasure to be with you. And thanks, Mr. Muhammad. Thanks, Dr. Salah. Thanks, Sister Khadija, for this big chance for us so we can meet and share our ideas. And we have a nice presentation today. It is the first presentation in our chain, and inshallah we'll continue our lectures, inshallah, for this kind of lecture related to Operation Theater. So for now, I will share my screen. You can see it?
Yes, very clear. Thank you.
Yes, okay. So this big lecture for role of perioperative nurse, but just today we'll expose or focus on the traffic zones inside OR. Okay, so Operation Theater, it is a special place. It is different from the other units in the hospital. And you can notice no one can go inside OR unless he will have or under some conditions. Most of the people outside OR, they don't know what is happening inside. Anyone going inside the operation theater, he should have some clauses or some special clauses if he is going to go inside. And that's why most of the people, they don't know what is happening inside or what they should do when they are inside the theater. And again, because it is special unit, because it is different from the other units, it has three different areas. And these areas, we called it traffic zones. Traffic zones. 3 different areas inside OR, and this one is called traffic zones. Okay. So you need to differentiate between these traffic zones inside OR. You need also to know what are the precautions in each area. And you can also enlist the patient safety measures inside OR. You need to know these areas, what you should do, what you should touch and not touch, what you should wear or not wear, and you need to have some precautions in each area. So at the beginning, you need to know our target is patient safety and patient satisfaction. All of us, and this is the most important thing, to have the patient safety and patient satisfaction, because we are dealing with a human body. We are dealing with a human being. So it is not just a disease or part of the body. We are dealing with a human being. And most of the patients inside OR, when they are coming for us, they are so afraid. They don't know what is going to happen for them, what will happen for them inside. They are so afraid, and most of them, they have phobia from OR. That's why you, as a beginner, if you are start your training in OR, you will also have some fear, or you are afraid from OR. You don't know what is happening inside. That's why this is the first step for you inside OR. You need to know what you will see inside, what are these zones inside the OR, and what you should wear in each area. So in any OR, we have 3 main areas. We have the reception area, where we are receiving the patient coming from the other units. And we have also the operation rooms, and also we have the recovery room. Okay, this lecture, it is translated Arabic English, so also you can read it in Arabic. So we'll start with the first zone or first area, which is called the unrestricted area. Unrestricted area. Unrestricted area, like reception area, where we are receiving the patient. So who can enter this area? This area, for anyone can go inside, like patients, relatives, patient family, other OR nurses, doctors, some people who's coming to ask about something, company representative, whatever. So anybody can go inside this area without any conditions, without any conditions. He can go inside with his normal clothes or regular clothes. But we are trying to arrange or to make it limited. We'll try to limit the people inside this area. Okay. So this area, including the entry of patient, like reception area, or the front desk, where the secretary is sitting and answering the phones or fax machines. And this area, anybody can go inside. The only thing we just need to make it the number limited inside this area. So for example, patient coming with his family, we are not allowing all the family members. We'll allow only for one member or maximum 2 members to go inside with the patient in this reception area, where the pre-operative nurses, they will receive the patient and he will keep them till patient is ready to go inside OR. The second area, it is called the semi-restricted area. Semi-restricted area. This area, including the corridors between the rooms and the store area or stores inside OR, which has surgical supplies or it has an instrument. So it has the corridors between the rooms. It has the store. This store could be for anything, could be for the surgical supplies or for the instrument. Okay, for these corridors, you need to wear the surgical attire. You need to wear the scrub suit. You need to wear overhead. You need to wear overshoes. Mask in this area is not necessary. But the important thing, you need to have the surgical attire, which has the scrub suit and the overhead and overshoes. Even for the patient, we are make them wear this overhead. So the patient can go inside this, also this, when he's crossing, he will also wear overhead. The last area, it's called restricted area. Restricted area. This is including the operating rooms. And as you see in the picture, all nurses inside should wear all the, not only the nurses, all the staff, all the medical team or surgical team, they should wear, yes, scrub suit, overhead, overshoes, plus they need to wear the face mask. So all the surgical team, they should have all this. The scrub suit, overhead, overshoes, and also the face mask. For the scrub persons, like the scrub nurse or the surgeons, they should have also sterile gown and sterile gloves. So they can touch the sterile instrument and they can be inside the sterile field. So again, the staff inside these rooms, they should have the full surgical attire plus the face mask. And for the scrub persons, they should have also sterile gown and sterile gloves. So these are the 3 zones or 3 areas inside OR. The first one, we called it the a non-restricted area or unrestricted area, and the second one called semi-restricted area, and the third one called the restricted area. If you are a new OR nurse, you should know these areas. You need to know what you should wear in each one. So for unrestricted area, anyone can go inside, but we are limiting the number of the people. For the semi-restricted area, it is the corridors or the stores inside the OR, but you need to wear the scrub suit and overhead overshoes. The last one, the operating rooms, we called it the restricted areas, especially if we have operation inside. And for this one, you should wear the full surgical attire, including face mask and sterile gown, sterile gloves for the scrub persons. So these are the 3 areas or traffic zones inside OR. I hope you enjoy this simple lecture, and I am happy with any questions from your side.
Thank you, Nurse Mustafa, for the interesting lecture. Very simple and very informative. Many thanks to you. May I leave the room for Nurse Khadija if she has any comments or additions?
Hello, thank you, Mustafa, again for the lecture. As Mustafa and Mr. Muhammad mentioned, this is like a very basic, simple lecture. It is just a start to show you or to give you an idea about operating room, because operating room is again is a very wide area, but as much as you take it simple, as much as it will be easy. So we are starting with the ABC. So the A now that we have is the areas. It might look so simple, but you really need to know each area of the OR, and in each area, how do you behave, or how do you act, and what to wear, and how to act, and what to do. So there is, for each area, there is a specific act to do, specific wear to wear, or specific.
You're muted.
I'm really sorry, I didn't
No.
notice. So I will start from the beginning. Thank you, Mustafa and Mr. Muhammad, again for this lecture. As you all see the lecture, it was very simple and very basic. Because operating room, it's a very wide area. So as simple as you take it, as much as easy it will be for you. Mustafa started with the operating room areas and zones. And it might look easy, but in each area there's a specific clothes to wear, specific actions to take, and specific care to give for the patient and for the staff with you. So it's really knowledge, or a must knowledge you need to have, because again, operating room is not like any other area in the hospital. It has its own rules, its own strict rules. Let me put it in this way. It's strict rule that we need to follow in order to maintain the patient safety, patient care, and our safety as a staff as well.
Thank you, Nurse Khadija, for your input. I think we came to an end now, and many thanks for Khadija for your enthusiasm and for making us know Mustafa. Thank you, Nurse Mustafa. We're very happy having you today, and of course, looking forward for many sessions in the future.
Yes,
Thank
please.
you, Mr.
And
Mohammed.
also,
So thank you.
Okay. Thank you, Mr. Muhammad. Thank you, Sister Khadija. Thank you, Dr. Salah. And also, I would like to add, we have some visitors coming inside OR. So sometimes you will be the one responsible for guiding them. So you need to know these traffic zones, you need to know what they should wear because you are the one responsible for them. So you will guide them. You should change this, you need to wear this, and you will guide them also inside OR, inside these areas. So in some situation also, you will be the one responsible for these visitors. That's why also you need to be familiar with this basic information about OR.
Okay. So, any inputs or additions?
From my side,
From
it's
my
okay.
And from my side, again, if anyone has any question or a specific topic, this is just the start. This is just the start, and we will take it from there. So if anyone has any topic or a question about the OR, just let us know.
Yes, sure. So thank you again, and we'll contact you afterward for planning for more sessions, inshallah.
Inshallah.
Thank you. Bye bye.
Thank you very much. Bye.